This section of our clinical practice adaptations for health risks of climate change is going to focus on the impacts of extreme heat. So we're going to identify some actions that you as a health professional can take to mitigate these harms of extreme heat, including looking at monitoring and forecasting, managing risks and exposures for your patients, recognizing heat-related illness, and just general patient education. Extreme heat is the deadliest type of hazardous or extreme weather, and extreme heat events can also simultaneously contribute to worsening air quality by trapping pollutants close to the surface and increase ground level ozone. So you can kind of get a synergistic effect of negative health impacts during these extreme heat events. Heat-related illness occurs when the body can no longer compensate for rising temperatures through either intrinsic or extrinsic cooling mechanisms. So once the body can't sweat, release heat, cool itself, then you lose those compensatory mechanisms and you start drifting into this heat-related illness. You can see here in the map yearly heat-related deaths by 2100 with no emissions cuts, and you can actually unfortunately see Montana standing out as an outlier with a particularly high rate per million people projected. So this is a significant issue in Montana as it is across the rest of the United States. Extreme heat can not only cause heat-related illness, but it can also exacerbate underlying comorbidities. So whether it's cardiovascular disease, renal disease, pulmonary disease, diabetes, or mental illness, we see exacerbations of underlying issues. Mental health, even in people without pre-existing mental illness, can be impacted. So we see increases in aggression, anxiety, and depression during extreme heat events. Renal disease, specifically even in those without underlying renal disease, there can be acute kidney injury, renal failure, and chronic kidney disease of unknown origin, or CKDU, that we're finding more and more in people, potentially people who are outdoor workers exposed chronically to extreme heat conditions. There are also workplace impacts. We think about reduced work performance, increased accidents as people are exposed to extreme heat. So in the left-hand side there, the CDC affects here the proportion of the population. So many people will experience mild symptoms, but that can range everywhere from just mild symptoms to heat cramps to emergency situations and even death. An important thing to note here is that the risk for hospitalizations related to heat-related illness varies across regions. So in the Northwest and the West, we're actually a little bit more sensitive to heat-related illness or extreme heat events. Part of this is that people are able to acclimate to extreme heat, but this typically occurs over a period of 1 to 2 weeks where the body can actually acclimate to higher temperatures. But in climates where it's actually a little bit cooler typically, and then we all of a sudden have a spike in heat, people don't have a chance to acclimate to that. And so these lower thresholds here for us to see peak hospitalizations, it's actually a much lower temperature here in the West and Northwest. Whereas in the South and Southwest, people are used to those higher temperatures, and thus they're going to see a higher heat range index for those peak hospitalizations. This map really just shows the same thing, same data that was at the last slide there, but it is another visualization for you to see kind of where we lie in Montana relative to a lot of the other United States regions. We're kind of moderately in there at 91 degrees being our kind of threshold for these peak hospitalizations due to extreme heat. There are various risk factors for heat-related illness that fall under some broad categories. So there are environmental risk factors, demographic risk factors, and behavioral risk factors. Some of these are modifiable, others not so much, but important to consider. So one of the first important things is location, both regionally, but also on a local basis, thinking about where they are within the city, what type of green spaces they have around them, and even hyper-locally thinking about what floor of a building are they on. That can make a significant difference in how hot their living area or the areas that they're being exposed to are exposure, so both duration and intensity, so how long are they exposed and how intensely is that exposure happening. Humidity, wind, shade, how much shelter are they getting, what availability do they have to get into cool spaces. Those are all going to be important factors for heat-related illness and risk reduction. Demographics, knowing that children as well as older adults are both at higher risk, so on either end of the age spectrum. Those with underlying health conditions or poor health status, obesity, poor physical fitness will be at a higher risk of heat-related issues. Socioeconomic status, mobility constraints, cognitive impairments, things that might inhibit their ability to respond, whether it's their ability to recognize initial signs and symptoms or just maybe social isolation, not having somebody checking in on them, not having somebody to help respond to either get out of the heat or recognize heat-related illness early on. Occupation, outdoor workers, people who are going to be, kind of disproportionately exposed to heat as a result. Think postal workers, people like that. That's all going to be a risk factor, and those people should be identified and kind of educated, managed closely. Drugs and medications we'll go through more specifically, but that's another important factor in risk that can be potentially modifiable depending on kind of the risk-benefit analysis of the drugs being used. Finally, behavioral. So what are people wearing? Are they drinking enough water? What are they doing for their diet and their activity? And how are they managing all of those things? That can be important as well. So one of the things that I mentioned in the last slide, the location as it relates to not only what region are they living in or what city, but also where in the city. Are they in a really rural, more park or suburban area, or is it something that's industrial or a very, very urban area? And you can see this diagram here showing the concept of heat islands. So in those dense buildings, very little green space, a lot of concrete pavement, that's going to be a much hotter area in a city versus something that's a little bit more of a park or a suburban area with more green area. These two maps at the top here are maps of Missoula and Billings, just to give you an example of what some different Montana cities look like as far as the heat islands associated with them. And you can see that the temperatures can vary widely just based on where a person is located in town. So is there green space, or is it something that's a little bit more, dense buildings and concrete and everything? And so you can see across those cities varying temperatures, and that can be an important consideration as you're thinking about heat risk. An important population to consider when you're thinking about heat-related risks to your patients is thinking about older adults. So on the left-hand side here, I mentioned previously the idea of age and social isolation being important. So this here is a map of Montana CDC data showing the number of older adults, or the percent of older adults over the age of 65 living alone in Montana. And you can see that there are definitely pockets here where there's a relatively high percentage of older adults living alone, which puts them at baseline at risk. Oftentimes, these older adults will also have underlying chronic conditions that increase their risks. And not only that, they'll oftentimes have medications that can potentially increase their risks as well. It's estimated by the CDC that more than 25,000 people living in Montana are especially vulnerable to CDC or to extreme heat. So we just need to think about this in our populations, particularly older adults and particularly some of these other populations of concern, as we're trying to think about how are we planning, how are we potentially taking proactive steps for our patients to look out for them and prevent these effects. This is a list of medications that are associated with increased risks of heat-related illness or adverse effects. So these medications either impair heat loss mechanisms, increase body temperatures, or maybe impact fluid and electrolyte balance that will contribute to adverse effects. So any psychoactive medications, you can kind of start thinking and being suspicious of those. Antidepressants, including SSRIs, tricyclics, antipsychotics, lithium, sedatives, all of those potentially increase risk. Also, anticholinergic medications, whether that's an anti-allergy antihistamine or another medication with anticholinergic effects, those will increase risk. Diuretics that may change fluid balance, such as furosemide or hydrochlorothiazide, are of concern. Beta blockers, calcium channel blockers, ACEs and ARBs, laxatives, amphetamine stimulants, and anabolic steroids, illicit drugs, also alcohol and caffeine, keeping those in mind. Those are maybe ones we don't always think about as medications or drugs, but it's important to potentially counsel patients on those being something that will increase risk as well. Other medication related pearls to keep in mind for patient education is special consideration of how either a facility or patients are storing medications during these extreme heat events or in extreme temperatures, or let's say, a mail order pharmacy or something like that. Are those medications being stored at a safe temperature where we're not worried about something happening where they're no longer effective and they're damaged by heat? So one of the first and best things that we can do with extreme heat is look at quality monitoring, planning, and forecasting tools so that we can plan, prepare, do any outreach, educate our patients, and kind of get ahead of things. These here are a list of all really good resources when we're looking at monitoring, planning, and response to extreme heat events. The CDC heat forecasting and monitoring. There's both an app as well as just an online website. All of these things are going to track the heat index. And the heat index is a measure of how hot it really feels when you factor in the relative humidity with the actual air temperature. So this is going to affect how easily the body can sweat and use evaporative mechanisms to cool. And the heat index is going to be important. If it's high humidity, then it's going to feel much hotter than if it's a place where it is low humidity. So this heat index chart here kind of shows the heat index relative to the likelihood of heat disorders with prolonged exposure and or with strenuous activity. So you can kind of see here that we start getting into the danger zone when things are in the low 90s, but this is, has to do also with the humidity, not just that temperature that you're seeing out there on the thermometer. So another measure that you may see out there is the wet bulb globe temperature, or WBGT. What this is another indicator of heat-related stress on the body when you're looking at exposure in direct sunlight, accounting for temperature, humidity, wind speed, sun angle, and cloud cover. So a lot of different factors at play here, but maybe a little bit even more precise than looking at a heat index. And this here, you can see that this gives you different categories, event conditions, and then the recommended actions and breaks for somebody who is operating under these conditions. So you can see, okay, if it's good conditions, it's green, normal activities, whereas if it's something where you're getting into moderate or more severe risks, then it's recommending, maximum 2 hours of training or activity outside, separating these things out, certain breaks, making sure that people are hydrating or completely avoiding outdoor training if needed. So this is from the United States Soccer Guidelines. It's an important consideration for people who are outdoor athletes, thinking about high school or college sports, managing those risks. But this applies for anybody who's going to be outdoors and be active. So how do we reduce environmental risks during these extreme events? If we're looking at people and we're reducing risks indoors, some of the things that we can do just at a very basic level are try to get people to be indoors in a weatherized home with good insulation, awnings, storm windows. Shade trees are another important thing that can shield buildings and prevent some of the heat from the sun from actually reaching and warming up the interior of a home. Keeping blinds and shades closed during the hottest times of the day. Fans can be helpful. If people don't have AC, they can help the body dissipate heat and can make rooms feel up to 4 degrees Fahrenheit cooler. Although it's important to keep in mind what the temperature inside actually is, and I'll talk about that in a later slide, but there's some debate at some point that fans may actually be more harmful than helpful. If people have ceiling fans, a little tip or trick is that ceiling fans are most effective when they're running counterclockwise to pull the cooler air up from the floor. They can be really great at circulating air and cooling things down. Always need to make sure that the temperature indoors is actually cooler than the outdoors if things are going to be sealed up and you're trying to really manage indoor air. In some cases, temperatures indoors are actually going to be higher than outside, and so paying attention to that, and if it's actually hotter inside, turning the fan to point things outward and getting that hot air outside. During extreme heat events, it's also good to minimize indoor heat sources, whether that's from cooking or incandescent bulbs or a water heater. These can all kind of add to indoor ambient heat. If people aren't able to have some sort of central air conditioning, they're not able to keep their entire room home, even just identifying a cooler room in the house and creating that one cooler room that can kind of be a little bit of a shelter can be a good way to do it. If air conditioning is too expensive, also recommending that people check with local programs to see what assistance might be available. There are certainly different assistance organizations out there that people who have lower incomes, maybe can't afford AC, can get hooked into air conditioning that it can greatly reduce their risk. The final thing is that there are places that have public shelters, public cooling shelters that people can go to if they're at home and they're unable to keep cool. In places where there aren't public shelters, you can just recommend that somebody goes to the library or the mall or something like that, recognizing that those may not be open 24 hours a day and accessible to everybody, but that is an option for people if they're at home and they just can't keep cool. If people can't keep cool indoors, then another option is to get outdoors. And or there might be people who are just outdoors anyway as a result of their activities, their occupation, whatever it might be. So if people are outdoors, finding green spaces with shade can be really important. As I mentioned before, the difference between some urban area that is concrete and buildings versus a green space with shade and trees to kind of help cool the area is going to be a lot different. Heading for the water, river, sprinkler like this guy here, using appropriate sun protection, trying to particularly stay out of the sun and stay out of or kind of minimize exposure during the hottest part of the day between 10 a.m. and 4 p.m. Making sure people are hydrated and not overexerting themselves, remembering that, depending on the temperature, there are going to be these different recommendations for the amount of activity, the amount of hydration that somebody should make sure that they are paying attention to if they're going to be out and active in the heat. Acclimatizing to hot temperatures as much as possible if there's an opportunity. It takes 1 to 2 weeks to get there, so it's not something that you can just do overnight, but if you know you're going to be in a place that's much hotter than what you're used to, or you're going to start working an outdoor job or something like that, there can be ways that you can slowly expose yourself to warmer temperatures and reduce your risks. And then if you're going to be outdoors, it's going to be really hot, you need to have a higher level of activity, choosing those cooler times of day, whether it's morning or evening. These can be important tips to give people to help reduce their risk of adverse heat impacts. Behavioral risks, including hydration, eating, other, clothing, etc., can all be modified. Hydration guidelines, 3 to 4 cups per hour, especially if somebody is active, but also remembering that they should consult with a provider if there are any type of fluid restrictions, if people have underlying like chronic renal disease, heart failure, things like that. Eating for the heat is something that can help, so avoiding heavy and hot meals, avoiding indoor cooking that might increase indoor temperatures, and also remembering that caffeine and alcohol are drugs that impact our sensitivity to heat and our risk of heat-related illness. Keeping cool by choosing loose, light colored, and breathable clothing. And you can also use like cool, damp washcloths, cool baths to help dissipate some of the heat and cool down. Staying connected is also really important. So remember that social isolation is a risk factor. Keeping up to date with weather forecasts and alerts so you know what's going on is important. So that's one mode of staying connected, but also checking in on neighbors, family, friends, kind of establishing a buddy system of sorts, whether it's, on your day-to-day life or if you're a worker or an athlete or something outside, making sure that you have somebody that you can check in with and you can monitor them, and likewise they can monitor you to try to make sure that, you are not experiencing heat-related impacts and you don't need medical attention. Other more specific tips for hydration, preferentially people should be drinking water over something that has a lot of sugar or salt in it. For the majority of the time, if people have an adequate diet, they don't necessarily need an electrolyte solution to rehydrate unless they've lost a lot of fluid or they're engaging in high levels of activity. Drinking in intervals, so periodic small volumes of water rather than a large amount all at once is going to be more effective. Absolutely don't wait until you're thirsty. By the time you're thirsty, you're already behind and already dehydrated. Avoiding drinks high in sugar, alcohol, or energy drinks. If people think they're going to be working out outdoors and they need their energy drink, that's actually a really bad idea in extreme heat. In general, when people are working in the heat, as I mentioned before, 1 cup of water every 15 to 20 minutes, so that's the 3 to 4 cups per hour. Might need more depending on temperature level of activity and fluid loss, so there are kind of specific guidance for athletes depending on their level of activity, the heat, etc. Also keeping in mind that people who maybe have concurrent GI illness may increase the need for more aggressive rehydration solution. The recommendation, while you should stay well hydrated, is to not drink more than 48 ounces per hour, because this can actually cause toxicity due to electrolyte abnormalities. So good to stay hydrated, don't overdo it. And again, reminding people that they need to take some precautions if they have certain medical conditions like heart failure or kidney disease. On the left, this is kind of a fun tool to give patients. It's a urine color chart, and this has been shown to actually be pretty accurate when compared side by side with specific gravity tests for urine to see how dehydrated a person is. So just based on the color of a person's urine, you can say once your urine starts becoming that dark yellow to amber to very dark color, that means that you're not well hydrated. We're looking for something that's, a very light yellow to a golden straw color that is going to indicate that you're well hydrated. And if you see anything darker than that, then that's going to be potentially problematic. Oftentimes with extreme heat, you're going to also see sun exposure, and it's important to kind of review or think about UV safety. So talking with people about considering their setting, if they're going to be outdoors, is there shade? What's the UV index? So, with a weather forecast, with a lot of weather apps, you're able to also not only track the temperature, but the UV index. Where are people going to be if they're out on the water or the sand or even in the snow? UV protection is going to be extra important because those surfaces can reflect ultraviolet light. Using good UV protection is really, really important with sunscreen, choosing SPF 30 or higher, applying 15 minutes before you even go outdoors, and then reapplying every 2 hours or after swimming or any type of significant sweating. Clothing can also be really important, but it is important to choose the right type of clothing. Not all clothing will provide good protection. So there's actually a rating, the ultraviolet protection factor, or UPF, looking for that at 30 or higher. A lot of clothes you're not going to know what their UPF rating is. General guidance there is that dark or brighter colors, denser fabrics, loose-fitting clothing, and maximal coverage, so covering higher body surface area, those are all going to be kind of general guidance that's going to give greater protection. Other risks to keep in mind for people with sun exposure and UV safety, age, so children and older adults on either end of the spectrum going to have a greater risk of adverse effects of sun exposure. And medications can also be an important thing to think about as you're thinking about photosensitivity and adverse impacts of sun exposure. This table here just highlights some of the most common drugs that are associated with photosensitivity. So everything from antibiotics to diuretics, anticonvulsants, sulfonylureas, medications used to treat diabetes, some NSAIDs, some cardiovascular drugs like amiodarone. All of these can potentially increase a person's sensitivity to the sun. And so these are other things to keep in mind, both when you're dispensing these drugs, when you're prescribing these drugs, giving them out, educating people in a proactive way, but also thinking about it if somebody's coming to the pharmacy to pick up one of these medications and you know that it's also, a hot, sunny day out, reminding them, hey, here's your hydrochlorothiazide. Remember that this can increase your risk of, being dehydrated, heat-related illness, and photosensitivity. Make sure you stay hydrated and use appropriate sun protection. This chart right here is from the American Family Physician and is just a nice summary of the different types of heat-related illness, kind of the spectrum of severity, the symptoms, and the treatment for all of these. And one of the things, I'm not going to go into extreme detail on all of this, but the important thing that I want to highlight here is the difference between moderate heat exhaustion and severe heat stroke. So looking at the difference in symptoms, making sure that you know how to recognize and manage or educate patients on how to manage these different conditions. So heat exhaustion versus heat stroke, you're going to be looking at different core temperatures, at presence of altered mental status versus some just kind of, beginning fatigue, headache, tachycardia, weakness in heat exhaustion versus full altered mental status, seizures, coma, tachycardia, etc. In the case of heat stroke or any suspicion of heat stroke, this is a medical emergency and people need to get to the emergency department as soon as possible and need to have a kind of intensive management of this condition. So making sure that people know this, that you are, that people aren't waiting too long to seek out care, which can result ultimately in severe complications and even death. This is a nice poster that you could potentially think about, if you're putting it up in your clinic or pharmacy or workplace or whatever it is. That's a patient education first aid thing to help recognize the difference between heat exhaustion, heat stroke. What are the primary symptoms that differentiate some of these things? Can you just take somebody to a cooler place, get them rehydrated, cool them down, and kind of watch them closely? Or is this something that we need to call 911 and treat this as a medical emergency? And so it's important, especially for people, whether it's athletes, outdoor workers, people who are potentially going to be exposed to heat, and we know their risks are higher, to educate them to recognize the signs of heat-related illness and basic management strategies. This can also be true if you identify somebody who's maybe an older adult on multiple medications that increase their sensitivity, all of those sorts of things. This should kind of be in the back of your mind as you're thinking about this. There are different posters, flyers, other outreach and patient education. These are some resources. There's a family doctor resource that has some nice heat-related illness patient education handouts. CDC does as well. There's a lot of OSHA, NIOSH resources for occupational health and exposures. There are also apps as well that can actually be nice to download. They give first aid, quick reference. There's a very specific heat safety app that goes through looking at the heat index, at recommendations for managing heat-related illness, etc. So these can be tools that you recommend or use yourself. This table here is adapted from a recent article from New England Journal of Medicine, and it just kind of highlights some recommendations for those working in emergency medicine and thinking about how we can be proactive in adapting to these extreme heat events. So everything from those working in emergency medical services, thinking about upfront protocols to measure rectal temp, initiate protocols for pre-hospital cooling, and making sure that there's patient education if somebody's exhibiting symptoms of heat-related illness but refusing transport. Maybe there need to be triage protocols in the emergency department, so there are daily alerts to clinical teams, knowing the heat index risks, remembering what the threshold will be for peak hospitalizations, having some sort of heat stroke pathway for quick response, various patient screening tools that you can think about implementing. So EHR flags for high-risk medications or those with underlying conditions. Screening on the other end for access to cool home environments if you identify somebody who's high risk or they're coming in with some initial symptoms of heat-related illness. Doing good patient education and discharge, even follow-up for high-risk patients after discharge, kind of monitoring them closely, making sure that there's a good plan for cooling and electricity dependent medical equipment in the case of power failure. A lot of times these extreme heat events also put a great burden on the power grid as people are using fans and AC and everything else. And then finally, thinking about healthcare delivery services. So how do you kind of prepare and plan, again, in that health system resilience planning, implementation of team drills, training, talking about what the facility will do if there's power failure or different supply chain vulnerabilities as a result of extreme heat events. So all of these things, kind of more of systems adaptations, but you as an individual can maybe step up and take the lead and advocate for some of these things if you're in an emergency medicine situation. Finally, here, just to try to apply some of the information that we went over in this section, here's a case, and I'll leave it up to you to kind of read through it, identify some of the risk factors, answer for yourself some of these questions, and we'll also have this case posted for you to take a look at as you're kind of working through this self-study material. But I think it's important to kind of think about the application of these concepts in an individual patient scenario and kind of run through it in your head to kind of solidify some of these things. That's all I have for you.